So rise up, champion. We're victorious. Who is greater than? Nothing can defeat her, God. Rise up, champion. We're victorious. Who is greater? Nothing can defeat her. Rise up, rise up. We're victorious. Say it again, say it again, say. Rise up, rise up. We're victorious. I lost my job, but I did not lose my joy. I have hope in you because I have you as my source. Said nothing can stop you, nothing can defeat you. You reign. Said you reign. King of glory. Said you reign. King of glory. Adonai. You live and sit on the throne. Undefeated. Champion, be seated on your throne.
Good morning.
Ruler, Redeemer, Savior of the world, undefeated. Champion, be seated on your throne. Ruler, Redeemer, Savior of the world.
This has been a activity in the making. I was excited when approached by
Jesus saved the day.
He brought me out. Anybody here know He will? He brought me out. I'm a living with Jesus. He brought me out. Anybody glad about it? He brought me out. Oh, I said He brought me from.
the best of this. So today's topic, as Ashley has stated, was about women's health, and so she approached me and
To the Lamb on the throne who gave his life for us, that we might have life and have it more abundantly. Glory to your name. You are the Lamb of God,
it's a very informal
the
discussion.
Lion of Judah,
Very interactive.
a mighty strong tower.
As we are Christians, our body is our temple.
You are an awesome wonder, in you we stand triumph.
Guidance. And so I think it's very important that we are very informed about our own bodies and our own health, all right? Okay, so we'll go ahead and get started. Just a small thing. Next slide. And so it is a joke there that says that the uterus transplant was a success. I'm sure your husband will you will find your husband much more understanding. And so I think a lot of times as women, as we transition through our reproductive system, a lot of times you feel like you're alone in that journey and that your significant other and families are not as understanding as they should be. So we'll go ahead to the next slide. And so when you think about fibroids, next slide, fibroids are pretty much benign growths that develop from the muscle to the uterus. And a lot of times when you think of it, the key factor is there are, majority of fibroids are non-cancerous. They definitely can range in sizes. Some are very small. Then you have some that are at least a couple of inches depending on the patient. It's very common in women of childbearing age, specifically women between the ages of 30 and 40. What we have found in studies is that it is very common in women of color. And there's a lot of research and studies as we're still trying to understand why. Some of the findings are associated that it is hormone driven, but the important thing is it is definitely a genetic component. And I think sometimes if we sit around at the family reunions and we talk, you're like, oh, so-and-so had, oh, you had it too? And it's very important that we have these discussions, not just amongst ourselves, but amongst our families, because you will find that, your mom had to have a hysterectomy for whatever reason, or your grandmother and things of that nature. So it's definitely important to, when you see your provider, to definitely have that family history and to have that talk, okay? Next slide. And so, one more. Thank you. All right. And so this is just a diagram that you can see of what a normal uterus would look like versus abnormal. And with fibroids, they definitely vary in size and positioning. And the key component that I've noticed as a provider is it depends on the position of the fibroid in terms of how can it affect the patient. Like the one at the top, you can see if it's like a pedunculate, it's almost like sitting on a stalk. A lot of times, depending on where their fibroid is, patients complain of back pain, they pain upper gastric pains, things of that nature. Then as you look off to the side, there's different some that can affect the muscle layer within the uterus, and those sometimes can also block the cavity and prevent pregnancy. And so it's very important that depending on your symptoms that you advocate and you have that discussion with your provider, because these are things that could potentially prohibit you from being able to have children. Next slide. And so as I stated before, it's not clear what causes fibroids. The female hormones and estrogen and progesterone actually have a potential to affect that. And then as I stated before, depending on where your fibroids are located, your symptoms may vary. Some women have pain, some have irregular bleeding, some have bloating. And to be honest, some women don't have symptoms at all. I can speak from experience. I didn't even know I had fibroids until I was pregnant with my first daughter. And of course, they go to do an ultrasound of the fetus. And they're like, oh, you have fibroids. I was like, oh, I do? Had no idea. But because of that, I was then aware to make sure that I make it a point that, yearly or every so often I go to check to see, okay, have they gotten bigger? Have they gotten smaller? Because that can affect your day-to-day life. And so when we're speaking of symptoms, that is very important, because depending on what you tell your doctor, of course, that determines how we as doctors help to diagnose. And so when you think of fibroids, a lot of times they are diagnosed based on your pelvic exam when you come in for your well woman, but that also we can take a deeper dive and do more imaging, such as an ultrasound, such as a CT or MRI, depending on what you find. Even in situations where patients aren't aware of fibroids, if they have to have a procedure for a gallbladder and they go in with a camera, you can actually physically see some of the fibroids and the distortion that they can cause. So that's important as well. And we'll go to the next slide. So treatment options. I think this one is very, very important because in the days of old, all I remember is my mama just saying, "Hey, you gotta get your uterus taken out." And you're like, "Well, dang, that is like so barbaric." And so I'm so grateful to be a part of a generation where we're like, okay, there has to be a better quality of life. Like, you just can't just gut me like a fish, okay? And so some of the things I like to have when I talk to my patients is there are tiers to your treatment depending on where your fibroids are. And one of those things is that sometimes patients are like, you know what? I want a more holistic approach. And as a physician, even though, we rely on science, there are other options. So conservative options will some people try, restricting their sugar intake. Some studies have shown that being careful with certain foods that you intake can also help with your quality of your symptoms. Other options, you then rely on things such as medication, which are hormone-based. Some people rely on birth control pills. Some people, we use what is called an intrauterine device, which helps to pretty much slow the bleeding down, but it also, studies have shown that it can help decrease the size of the fibroids, at least keep them stable. Other options that are listed, there's a few on there. We do, it's called GnRH, which is a form of a hormone that we inject to shrink the fibroids. A lot of times for my patients who have not completed childbearing, I may go this route because it's like, okay, if you don't want surgery, then this may be an option to help us shrink the fibroids and help treat those symptoms. Then you go to your third tier, which would be your surgical approach. Now with modern day studies, we have had that option of where you can get what we call myomectomy, where it's almost if you envision coring out an apple, where you core those fibroids out depending on the size and location of them. Other options would be where we rely on embolization and radio frequency. So just how like with surgeons, they use radio frequency to break up gallstones, we now have seen options that that women have that option and are still able to keep their uterus. And then, of course, lastly, just a good old-fashioned, hysterectomy. But honestly, for me, I tell my patients I'm not very scalpel happy. So if I can find you an option that is safest for you and minimally invasive, then that's the route we'll go with, okay? Any questions so far? Okay, all right, so we'll go to the next slide.
Before we move on to the next slide, can I just say, just me and what I tend to go through and like finding doctors and them telling me, oh, well, we can just do this and we can just go to surgery, not having options. Like hearing this from someone that looks like me versus someone that doesn't look like me is more comforting because I feel like I am in childbearing age, and even though I don't have children, it's like, well, until you have children, we'll figure it out, but we'll make you suffer until you have children.
Right.
So, yeah.
Yeah, and I think, unfortunately, as a physician, we do have to own our part in understanding. And I tell people the story all the time about why I got into medicine. I'm from a small town, West Tennessee, Covington, on the way to Memphis, exit 56. And, and I think for me, I remember I was raised with my grandparents, and I remember going to doctor's appointments with them, and I was like, they're talking at them. They're not talking to them. And I think a lot of times as physicians, we like to use medical jargon and things like that. But if a patient doesn't understand, how can they make the best decision for them? And so I think even as women, it's best to, that's why I said minding your own uterus. You have to, take ownership and try to find that information available. But also as a physician, we need to make sure that we find ways to communicate with our patients so that way they know their options. If I draw pictures sometimes, whatever it takes for that patient to feel like, okay, I have been informed, now I can make the best decision for me. Yeah.
To piggyback on that, as a nurse, a public health practitioner, who's obviously a Black woman, I'm very passionate about Black women having Black healthcare providers for those very reasons. We don't want to be talked to or talked at, we want to be talked to. We want to know what our options are, and we want somebody who has the cultural competency to understand our love language as Black women and approach us in a manner that feels good to us and that is good for us.
Yeah.
And that's really important. And I'm always an advocate of try to find a healthcare provider that looks like you.
Yeah.
And if you can't, all right, But first, look for somebody that looks like
Yeah,
you.
and I definitely agree that portion is important because I've had some patients come to me and share their same story where they're not given as many options
Yes.
or the idea of that our pain is not real, and it's like, okay, just because I'm not in here crying doesn't mean I'm not having these heavy cycles or I'm not feeling this way. So I definitely think that it's important, to, if you have that option of finding a doctor who looks like you, but more importantly understands you and what you are going through, so that way you find the best treatment options available. So, yeah. Yes. Yes, absolutely. Can you take, it should be 2 steps back. If you do endometriosis, if you click backwards one more time. One more time. Well, wait, come back one. There we go, yes. When they are, so are you asking the one, so are you meaning the cervix or the actual uterus? So with the, so I think what you may be referring to when we do the laser is, that one is through the cervix, but there is the procedure with the myomectomy to where you can go in and kind of what I was explaining about coring out that fibroid, but the key is it depends on the position of the fibroid and the size of it. But yes, in terms of laser, a lot of times when we use laser removal, that particular procedure is a LEAP where we remove the abnormal cells from the cervix. But that's not listed on there. But the one that I was referring to where it's coring out, that one is a myomectomy, and then the other one is the radio frequency one where they use ultrasound guidance to kind of almost break up the fibroids. Does that answer your question?
Think so.
Okay. Anyone else? Okay. Oh, yes. Yes, ma'am. Okay. And this is good. I prefer this because I feel like I operate better in discussion, like an open discussion versus lecture. I don't like being lectured to, so.
Sorry. My question has to do with age because if there's a family history, my question has to do if there's a family history and you know that there's a family history, and the earliest, the possibility of a young black female potentially developing a fibroid in your experience and in the literature dealing with the black culture, have you found the youngest age that it's possible? Because I've been told that it's impossible for my 24-year-old daughter to possibly have a fibroid.
Well, I personally, from personal experience, can that rumor is not true for sure. Because my first one, I was in my 20s, and when I was 27 when I was pregnant with my first daughter, and I already had 3 fibroids, so they came from somewhere. But the thing is that most of the time when we think about going to a gynecologist, there's this gap. It's like go to a pediatrician, and then usually most of my patients, they usually don't come to me until they are pregnant, which is, like you said, you're already in your 20s by then. Well, by that time, that fibroid has already been growing, but your body may not manifest symptoms. And so I think for patients, if you do have a very strong family history, there's nothing wrong with you saying to your gynecologist, hey, I want to have children. I have this strong family history. Is it possible for me just to go ahead and get a pelvic ultrasound to see if they're present or not? Because a lot of times what I have found is that it's almost a too little too late. So by the time this patient has come to me, she's like, hey, I've been trying to get pregnant for years. I haven't been successful. And then she has 5 or 6 fibroids that have already been there, and she's in her mid-20s. And so I think early detection just with anything is key. And so for your, just for your benefit, I do definitely think that, talking to your gynecologist and seeing them as early as sometimes 18 to 19 is definitely beneficial. Me, from personal history, my youngest patient is 13. And it's not for fibroids, but she has, heavy cycles. And I think, her getting in and actually establishing a relationship with me is key because, one, she gets the information she needs, but also I can help better develop a treatment plan for her that is safe for her, but it's also helpful. Does that answer your question? Okay.
Potential for having fibroids.
Mm-hmm.
And this person grew up in an institution that was very vanilla and exposed to limited people of color. And because of our insurance for my daughter, we were pushed toward this type of provider, and I'm actually looking for a person of color who can understand my conversation.
Absolutely. And definitely and we can definitely, I'll be here if you want to have more personal dialogue. I'm totally open to that. But I definitely think it's key, especially with insurance companies, because they will say, oh, this is the only person that you can go to, and that's not necessarily true. It takes that step of you trying to find that person, actually calling the office, say, hey, do you take this insurance? Because a lot of times they will, but that's just not what insurance companies may push towards you, if that makes sense. Yeah.
And I'd like to add to that, I'm always mindful and encourage others to be mindful of where they get their information from. You being told that your daughter couldn't have fibroids at such a young age was misinformation. And I know for a lot of us, we don't always know the source of where we get information, but it's important that we have a trusted source of where that information is coming from. And to the storytelling part of our discussion today, it's important that we talk to our children, we talk to each other about our health histories. If I'm Gen X, so my grandmother was from the Great Generation, my mother is a baby boomer, and they were very tight-lipped, and my mother is still very tight-lipped with certain things. Once I've had the experience, she'll share little bits and pieces, but giving me the information I need to prepare me for that experience has not been a part of my adulthood. So having those conversations, age appropriate if you're having them with teenagers, preferably have those conversations when they're younger so they know what to expect as they're growing.
All right, I'm a physician at Vanderbilt and OBGYN, and as you were speaking, it just made me realize that we have screening protocols for fibroids that are really symptom-based. So you have to have pelvic pressure or heavy bleeding or problems with pregnancy, and then that'll make us go down that path. And we don't always ask if you have a family history of fibroids. That's something that we kind of depend on you to bring up to us. So we're behind in that regard in terms of asking you about that history on the front end. But then it involves that conversation of you saying, yeah, I'm worried about this, and this has been a problem for me, and I want to get more information. And so I think that this discussion is so helpful because it makes us realize that that history is key to doing the testing in addition to just doing the physical exam. The ultrasound can be so helpful. So telling your daughters and your other family members, yeah, we have this history, you need to talk to your doctor about it, tell them that you want more information, you want a very good exam, and you want to know if you have them, because then that kind of directs the conversation.
All right, anyone else? Okay.
I have a question too.
Good morning, and thank you for this platform and opportunity to speak. So in the world that we're in now with TikTok, on there you see castor oil packs. Do this with the castor oil. It'll help with the fibroids. You know, people don't want medicine, so they want to go with a holistic way.
Right.
So what do you ladies think of that?
I think
Your source.
thank you, because I was
Your
gonna say-
source. I have a TikTok with probably 100,000 followers, but I always tell people my background so they know what information they're getting. They can go to my website and do more research on me. There are a lot of people on social media that will just share information that is not accurate, and some of it is actually harmful because people will take that information and run with it. And I could go down a rabbit hole of what those outcomes could be. So TikTok is all the rave right now, but please just be very diligent in who you are following and do your research on who that person is to make sure that you are getting accurate and timely, because as Dr. Washington said, hysterectomies were the thing back in the day. Some doctors will still opt to just take your uterus, but there are other options. So you want timely information that is backed by science. I do believe there are healing principles in castor oil. However, there are a lot of variables. There are a lot of variables that go into how to use it, when to use it, why to use it. When I did my training in midwifery, the midwives were giving women castor oil to rub on their cervix to induce labor. And I can only tell you it was catastrophic in a lot of cases. So yes, there are healing properties to it, just like there are any other natural substance, but we have to know how we're using it.
Thank you.
Thank you. I would just like to come back a little bit to the storytelling experience, because I am a parent of a special needs child, and she also has an expressive language delay. So I can only communicate to the physician provider what I think and what I see and what I believe she's experiencing. And in my case, he wasn't listening. And I would like to say to anyone else who in here who has a child who is female that is not able to express what her symptoms are, is to please be encouraged to be that advocate. I'm just an advocate by nature, and I push the button so I get a label, and I was just trying to be nice that day. But I knew that I was moving on because I wasn't being heard, mainly because of their experience and their limitations and exposure to people of color.
Oh. Okay, well, I can actually, that does hit close to home, even for me. So my youngest is on the spectrum, and she is a female. And even from personal, professional experience, I do have patients that are special needs and have various genetic disorders. And I do think that's it's a hardship for parents, because not only do you have these young children who have symptoms, but now you have this barrier, they're not able to communicate how they feel. And I think that's where we as providers have to step in and have that extra time of patience. Like for my special needs patients, I actually carve out actually more time for those visits, just because I know they're going to need that more attention than what a typical teenager may need or an adult. And I definitely can sympathize with you, because that is a challenge. But my advice would be like, never stop fighting for your child, never stop advocating for your child, and then just researching those options. They do have a lot of tools now, especially through social media, where there's different platforms of mothers who can recommend different strategies for you, as well as providers that can, help with that.
Oh, good morning. Thank you for doing this. I'm very appreciative of it. I had a question. As someone who's had a myomectomy and that's in my mid-30s, is it still possible to have children if you've already had a myomectomy? And then having had one, what are some steps that I can take to continue to make sure I'm educated on what's happening with my body? Because what I experienced is doctors that, like, if you don't have any symptoms, they're like, oh, we don't have to worry about those because you don't have any, you don't have any symptoms. But I know that the fibroids I had were significant enough, and I had multiple, that that step was to do the myomectomy just for quality of life. So I just want to make sure I'm being proactive on next steps and making sure that, it doesn't have to be another myomectomy or hysterectomy, and I can make sure that I'm doing everything possible to be able to have children when that time comes.
Definitely. So patients with a history of a myomectomy, it does depend on how it was performed in terms of the size of the uterus and things like that. but you can absolutely still conceive after having a myomectomy. I think it's definitely important that once you do have your follow-up with your provider, there's nothing wrong with you advocating and saying, I have this history. I just want to make sure that these fibroids are not reoccurring or that there's more that's growing. And so you can advocate to have imaging during that time just to make sure, because like you said, you don't want to get into a position where, yes, we remove the fibroids, but 5 years from now, you're in the same boat, and it's not only affecting your quality of life, but your ability to have children.
Thank y'all for asking questions. This is great. I'm enjoying this.
Me too.
Thank you. Mine's so much not a question, but a storytelling and testimony to you can't have a child after myomectomy, major myomectomy. So at the age of 38, well, it really started about 36, and it took them a while to determine that I actually had fibroids. And by the time a little known clinic found out, where all the other doctors and OB/GYN had never done the test, they finally discovered for me that it was fibroids. And by then, they were so massive that I went to the first doctor, which was at a Baptist hospital, and it was a person of a different culture. And his response was, the only thing I will do for you is a hysterectomy. You're nearly 40 years old, you're not married, you're in ministry, you're not gonna have a child out of wedlock, so all I will do is a hysterectomy. And I said, thank you, goodbye, because the Lord had promised me that even though I did not plan to get married till about 40, I would have a child. And so I found, through other people, I found a doctor who would work with me, a female, who had been through the same experience, but she had already had at least 1 or 2 children. But she said, I want to honor, your faith that you're gonna have a child after 40. And so we'll try to save your uterus. And so she said, but most times you bleed out when you have that many major fibroids, and I had some as big as grapefruits by then. So she put me on medicine to shrink the fibroids, to lessen my time, that when I had the surgery, I would bleed out. And so a few weeks later, well, probably about a couple of months later, we had the surgery. And sure enough, 3 hours into the surgery, they had even gotten the main ones because they found out they were also in my endometrium. And so they were gonna have to take my uterus to save my life. Well, she had mentioned it to a fertility specialist, and he came by to check on her and took over my surgery. And so when I came out, they were like, here's what happened, you almost lost your life. Happened to come by, a God thing to come by and save your uterus, but he was there and he says, but I don't know if I saved enough uterus for you to successfully get pregnant. But my reward will be when you have that baby, let me know. So less than a year later, about a year later, I was married. 9 months later, I gave birth to a healthy daughter who's now 26 years old.
Amen.
Now, the other part of that story, that's to the yes, after even a major myomectomy, yes, with God, all things are possible. And he promised us, and he tells us to be fruitful and to multiply. So then the other part of that story as a black woman is that they told me by getting pregnant, those fibroids would start growing again because of the healthy blood flow. And so after I had a baby in the Catholic hospital, so they would not do a hysterectomy while I was there. And by the time I would heal enough to go somewhere else, we had moved to another state. And so then it proceeded to be a couple of years of a battle with the medical field to have this hysterectomy, because by then I was in such pain. The fibroids that were grown back had attached to all my different organs. And I found a black male doctor whose wife was also in holistic medicine, but he was the OB/GYN, and he fought for me. But they said before what had happened was, it was a way of curtailing black births, that they had been giving hysterectomies to black women so quickly. And that was their only answer. So then the insurances had found out and put a stop to it. So then after that, that meant I had to spend 2 years fighting the insurance, and always I would appeal it, and the medical response would come back, usually males, saying, no, you don't need this. It's like, but I'm in massive pain. So my doctor finally said, there's no reason a woman has to go through that much pain. We're going to do the surgery, and then we'll continue to fight the insurance company. And so I went ahead and had a total hysterectomy because all the fibroids had attached to my ovaries and was attaching to my bladder and everything. So I went ahead and had the total hysterectomy, and we did continue to fight. And the good news is that eventually the insurance company did take care of the operation. So I say, don't give up. If you know that you know that you know, and you have the will and you have the faith, fight through the fibroids, the major myomectomies, because God has the final say so, not medicine.
I'm going to turn it back over to Dr. Washington.
I have a question.
Yes, ma'am.
Yes, I'm an emergency medicine physician, and one of my issues with medicine is that we talk a lot about disease and we don't talk as much about prevention. And that's a real pet peeve of mine. I think we miseducate people sometimes because we don't help them be healthy, and we help them to be sick. So would you address some of the ways that we might help ourselves with this issue? Are there things that we can do to minimize our risk?
And then if you want to share as well, I definitely appreciate. So it's interesting because on the drive in here, I was thinking about not just from the GYN standpoint, but from the obstetrical standpoint of how I've seen our generation become more and more unhealthy, and the epidemic and pandemic that comes with that. And so a lot of times, I'll be transparent, I think depending on the physician, they may not always be comfortable because they feel like, okay, this person may be offended by what I'm going to say to them. And I think a lot of times it's establishing that relationship with that patient, trying to meet them halfway in terms of what their goals are. I have real conversations. By the time I have that second visit, if I see certain things that this patient is at risk for, I'll be like, all right, girl, we're about to have this conversation because your blood pressure looks like this, and this is why, because I'm seeing you over here eating this, and I'm seeing you drinking this. And it's like I always try to specify, there's no judgment. I just want you to be the best version of yourself. And I think if you lead in love for that patient, no matter what their race or creed is, I think a lot of times you can break down those barriers and then they will be more receptive. Because I think, again, to my past story, I think a lot of times if you're talking at a person, they're not going to be as receptive. But also, we have to be honest with ourselves as people. We have to take ownership for what we do as well. A lot of times I'll have patients who want to come in and conceive, but their blood pressure's already through the roof and they're already overweight. And so it's like, hey, I'm not here to judge you. I just want to help you, but I need you to do this with me. Does that answer your, okay. Do you want to piggyback on that?
I would say education. Educating ourselves on our bodies. Know how your body feels when it's healthy, so when it's not healthy, you know that it's not healthy and you can seek the right help. If you're not comfortable with your body, if you don't know how your body feels when you have great energy, when your blood pressure is at optimal levels, when all of your blood results or your blood levels are where they're supposed to be, you won't know when something is different. So educate yourself, get comfortable with your body, know how it's supposed to feel, and attend discussions and sessions like this. You want to hear from people who can give you the information from the perspective of Black culture. Because as Black women, we're always going to be looked at differently in healthcare settings. And as a healthcare practitioner, I feel comfortable saying that because I've experienced it on both sides, as the healthcare practitioner as well as the patient. So surround yourself, build a community, build support, educate yourself, and get familiar and comfortable with your body.
Besides the family history, what other things make us more at risk?
Being a Black woman.
And that. Yeah, family history.
Being a Black woman.
Tenfold, absolutely. As I stated before, we have no real understanding medically of why we're more prone to fibroids. There is certain studies even dealing with, and you can attest with chemicals now, if you notice, they've said that because we've relaxed our hair for so many years, the chemicals that are in that. There's actually a study going on now at Meharry Medical College where they're studying women that have had their hair relaxed for so many years to determine if what those components in those relaxers have caused, us. And even though I'm medically trained, I think I'm from the school of less is more. And so now that we are in positions to where we can try more natural approaches to how we treat our hair and how we treat our bodies, I think, like she said, it's best to educate yourself to find those treatment options that, of course, are within reason and that are safe.
I always say that as Black women, we have the experiences, the bountiful and beautiful experiences of being a Black woman, and also the burden of being a Black woman. And that burden can be an umbrella for so many different experiences that we have as Black women. But just trying to find our place between the beauty and the burden of our Black womanhood sometimes can be challenging. But again, finding the right support, the right healthcare providers that are going to listen to you, that are going to hear you, and that are going to see you as the person that you are really important.
Hello, thank you for this event. I want to know, or I have a question. So I had endometriosis, epidemiosis, fibroid, cysts, all the horrible things, right? I ended up having first, because this all happened in 2015. First, I had some cysts removed. No, I had an ovary removed. I had my right ovary removed. The doctor went in. He was like, "Look, I think we need to go ahead and have a hysterectomy." Had a total hysterectomy, and he butchered me. I had 3 surgeries in 30 days, and 2 of those surgeries were 10 days apart. I had the right ovary removed like right before Thanksgiving, and then December the 8th of 2015, I had my total hysterectomy. December the 18th, and when I had the hysterectomy, I was bleeding. I was bleeding really, really, really bad. And I ended up telling my doctor, I was like, something about this isn't right. The medicine isn't medicine, Why am I still bleeding? Do you not supposed to stop bleeding after you have a hysterectomy? Because I would bleed for months. I would bleed for 2.5 months and then be off and then go off. This was after being on birth control and all this. So I have been experiencing this since I was like 12, all the way up till 2015. And so, he butchered me the whole 9. So I called the doctor, and they were like, "Well, doctor such and such says if it's that bad, go to the ER." So I go to the ER, and I was like, my stomach was out here. This was in the 10-day time frame. They wanted to check me, and I'm like, "Look, I am hurting. I am hurting really bad. Please don't check me." And it was a nurse of color. She said, "I'm going to be as gentle as I possibly can," because they wanted to see if I was bleeding internally because they could not find where this blood was coming from. I was wearing a pregnancy diaper. After you have your baby? Yeah, I was wearing that. That's how bad I was bleeding. And so she said, no. She said, "Well, I don't know what's going on or what have you, but what I do want to do is draw some blood." She was like, "Well, for whatever reason, your blood count is okay per the lab." I said, "Okay." That was on the 16th. On the 17th, I went in to see my doctor. And I don't really go out public looking a mess, right? And I wore a muumuu to the doctor's office. That's how bad I was hurting. And so when I was in the waiting room, and I'm an educator, so I love children. Well, the children were getting on my nerves. That's not really my behavior. So I asked the receptionist, I was like, "Look, is he going to be able to see me? I'm in a great deal of pain, and I don't have time to be,
hi, and he with these kids. I don't want to hear that. I'm hurting. And she was like, oh, Tanisha, you were in the ER. I was like, yes. So I go back, and they escort me to the room or whatever. And I was just crying. I couldn't really walk. I was in so much pain. And so he said, well, Tanisha, I have to mimic his voice. Tanisha, I'm gonna have to check you to see what's going on. And I just start crying. And he was like, well, I don't believe you. So luckily for me, I took pictures and videos of everything. And then I also pulled down, and I couldn't wear underwear. I was wearing men's boxers, okay? And I took, I disrobed, and I showed him just how bad I was bleeding. And he was like, oh my God, oh my God. So he said, well, we're going to admit you to see what's going on, right? So I go in, that was the 17th, so they admit me back in the same hospital recovery room or whatever the case. And he said, I want to do, I guess it's a CT scan. Okay, yeah. He was like, I want to do a CT scan to see what's going on. Okay, great. So I get a phone call. No, the nurse, a nurse comes in and she says, Dr. Such and Such told me to tell you you cannot eat after midnight. I said, why? She said, he's going to give you a call. So he called me, and he said that I had developed a massive abscess, that he cut me. Apparently he didn't patch me up. He just glued me back together. And I guess that's the norm or what have you. He, it didn't work or what have you. And I had developed a massive abscess, and it was leaking throughout my body. And so we had to go in December the 18th and for him to cut me all over again, just as deep, to drain all of that out. The beauty of it is I had a Black female nurse who made sure this go around that he did everything he was supposed to. He knew how scared he was, or that he had, messed up or what have you. Because as I was going, when I went to go prep for surgery, he says to me, Tanisha, by his stripes you are healed. I was like, oh, that's classic. I mean, that's scripture, but that's also classic. And so the nurses, a lot of nurses from Tennessee State University took really good care of me. And they said, oh, well, you didn't know he was the worst doctor in Nashville? No, I didn't. I didn't know. And so I ended up having 42 staples and in places where no woman should have staples. And I tell my story to make a statement. Ladies of color, please ensure that you have a physician of color. Mine wasn't, and he almost took my life. Like right after my son's 18th birthday, he could have killed me, and he knows that he could have. The other thing that I have is a question. Is there, being that I've had everything taken, and I do mean everything, okay? Do I still need to go see an OB? And they have told me that I should not.
Oh, Lord. I don't know where to start. Okay. You want to go first? You want me to go first?
Well, I will say OBGYN and Dr. Washington will attest to this, are not one and the same. You have some doctors who are obstetricians who deal with fertility and pregnancy and childbirth and postpartum, and then you have gynecologists that deals with women's health issues and women's health in general. So even though you've had a hysterectomy, you should still be seeing a woman's health provider, even for your breast health. You should still be seeing, yes,
colon, all of it, yeah.
all of those things. You don't need to see an obstetrician because you're not pregnant, but a gynecologist, yes, absolutely. And I'm so sorry you had that experience, and I'm grateful that you're here.
Just to piggyback what you, because I was just sitting here in awe, and I'm like, my God. On behalf of physicians, I do apologize. We're definitely not God, but I think the key is when we take that oath, you have to understand, one, when you are out of your scope of practice. If the case is too complicated, I tell patients, I'm not going to hurt you more than I can help you. The other caveat of that is also listening to your patients. I don't care if they call me the CT queen. If I got a patient that is in pain and I know that patient and that's not her character, I'm going to do imaging. Days should not go by before you get imaged, because that particular situation actually happened with, I think it was Judge Hatchett's daughter in California, and she lost her daughter-in-law, and she actually lost her life. And I think a lot of times you can't minimize someone's pain. And so for me, I would rather be, overly, aggressive with imaging versus missing something, because those things do happen. We're not perfect and complications do happen, but I think it's recognizing when those complications occur, so that way you can take the steps to, fix the situation. The other caveat, and to piggyback, absolutely. So even though your female organs are gone, there's when we close, depending on how they close from below, you still have a cuff that is there, and you want to make sure that you're still going for your exam, and more importantly, also your breast exam, because a lot of times, especially in Black women, we have more dense breast tissue, and a lot of times a mammogram doesn't always diagnose those things, and so sometimes if you are not going, there could be a gap to where things could be forming in the breast tissue all the way up to the armpit, and you don't realize it until you're like 40. You know what I'm saying? So I definitely think, even though, like she was saying, so for me, even though I do the component of delivering children, being an obstetrician, there's also that women's health component that you still have to maintain. Does that answer your question? Okay.
Well, we're going to go ahead and finish your PowerPoint, getting
I
the
forgot all
PCOS and
about
endometriosis, and then we're going to pass it on to Mysore, Asiya, and continue on.
So really quickly, because a lot of it we actually have already incorporated in, so we'll go ahead and go back. There's a few things that actually wanted me to mention to you all in terms of endometriosis as well as ovarian cancer screening. So if you go up, next slide. Yes, okay, endometriosis. Ooh, it's the bane of my existence. I don't know where this came from, but I don't like it. Okay, next slide. So with endometriosis, it's a condition to where, okay, go back one more, I'm sorry. Okay, forward, I think it's maybe one missing, hold on. Okay, come back to the picture of the uterus. And so the most important thing that with this that so with endometriosis comes from, it's a condition where if you see within that uterine cavity that kind of darker pink layer, well, that darker pink layer is supposed to, the actual endometrium itself is usually confined within a normal uterus. But with endometriosis, as you can see to the right picture, those portions of what's inside the uterus actually starts to implant on other parts of the body. And it's not limited to, sometimes you can find implants to where you can see it on the top of the uterus, you can see it in the ovaries. I've seen some patients, it's on the bladder, it's on the bowel. And because of that, a lot of times they have some of the most painful cycles, painful bowel movements, painful intercourse, and it can be a very, it can be a struggle for them. Next slide. And so, as you can see from this, it can cause an array of symptoms. A lot of times patients have heavy cycles, they have difficulties with bowel movements, and a lot of times these symptoms are even worse when they come on their cycle. I have some patients that come to me and say, when I come on my cycle, I can't even come out of the house. And it's very unfortunate. This also can not only affect your ability when you have cycles, but also the ability to have children. Sometimes intimacy in that portion is very difficult for them because it's also painful during intercourse as well. Next slide. And so the reason why I left this blank, it was intentional because with diagnosis and treatment, The tricky part about endometriosis is a lot of times you really have to listen to the patient, because sometimes you can't see it on just an ultrasound or an MRI or even a CT. A lot of times it's basically based on how the patient is feeling, and we do have a screening tool that we use to where it's almost like a checklist, and based off of that we try to see, okay, if that's the case. To truly diagnose endometriosis, it's done surgically, where we actually go in and are able to actually physically see the implants. But for me, a lot of times it's like, okay, I don't want to always have to cut you just to get to figure out what is wrong with you. And so with treatment options, when it comes to endometriosis, it is similar to fibroids in a sense, because a lot of it is hormone driven, unfortunately. One of the things I have noticed, and you could probably attest to this, is that I've noticed that in some patients who do make lifestyle changes, such as watching what they eat, watching their sugar intake, there is a famous, what's the name? I think it's like Tia Mowry. She was having issues with fertility, and she really did change the way that she, what she put into her body. And some of my patients actually get better results with that, as opposed to doing, medicine. And don't get me wrong, medicine is good, but it's not the end all be all, right? Okay. In terms of treatment options, a lot of times, depending on the severity of your endometriosis, sometimes we do try to shrink it, which we can use the same GRNH that we use for shrinking fibroids. It kind of puts a Band-Aid on it, though, unfortunately. Surgically used with endometriosis, depending on the severity, the doctor will go in and laser off those abnormal portions of the endometriosis. But I'll be honest with you, the bigger they are, the harder they fall. So the more implants you have, it can lead to scarring. I've opened up people sometimes, and it just look like cobwebs. And I was like, well, all right, this ain't what I thought it was gonna be. And so a lot of times that does involve bringing in a specialist, because that's out of my scope of practice. Because if this endometriosis is attached to your bowel, I'm not messing with that. And so it's an unfortunate situation to where, like I said, it's like my least favorite, because it's like this patient has these symptoms, but you don't realize how bad it is until you actually go in. But with treatment options, there are different medications, lifestyle changes, and then, like I said, that last tier would be surgery. Next slide. Okay, the last thing I wanted to touch on in terms of my talk was ovarian cancer. And it does hit close to home, because I will share a story. There was this lady, I was in residency, I was at St. Thomas West, beautiful black woman in her 50s, and she came in with, her stomach was like, it looked like she was pregnant. And she was like, Doc, I done hit menopause. I don't know why my stomach looked like this. So we're laughing and we're talking, and they do the imaging, and she has so much fluid because the cancer has pretty much taken over her body. She didn't even realize it. And so she was like, well, I'm a businesswoman, I've been on the go, and it's so important, as I tell people, to really pay attention to your body. She's like, well, I noticed I had like a pouch, but I just thought I was getting older. Fast forward, we go and we test, we draw the fluid off, and she has stage 4 ovarian cancer. Had no clue, and in a matter of minutes, I have changed this lady's whole trajectory of life. And so I do advocate for patients, and with ovarian cancer, it affects one or more, both of the ovaries. Such risk factors is age older 55, if you have a family history of breast cancer, ovarian cancer, or a personal history of breast cancer, patients who have never had children, patients who struggle with infertility and endometriosis, these are all risk factors. Next slide. And so the key component that I tell patients in terms of we're definitely paying attention to your body is don't hesitate to get those checkups. Don't hesitate to, ask your doctor in terms of options, because unfortunately when it comes to ovarian cancer, it's different from cervical cancer, it's different from endometrial cancer. A lot of times there's not an annual screening tool that you would use to check for it. We have what we call tumor markers, where we look for CA125 or OVA1, but that just scratches the surface. And so a lot of times I tell patients the key is early detection and really, really paying attention to your body and fighting for what it is that you feel like is happening to you, as she stated. I think that one's, go to the next slide. Okay, yeah, that sums my portion of that up. Thank you so much for listening, and we'll take more questions and anything you want to piggyback on.
So, Dr. Washington, as you were sharing about the risk factors, I'm thinking to myself, I need to just go sit in the corner and just wait. Just wait for the Lord to call me. So those risk factors can be very scary. Breast cancer, I'm a breast cancer survivor. Endometriosis runs in my family. Infertility, I've struggled with infertility. Just hearing those risk factors can be very, very scary and very overwhelming. But know that risk factors don't mean that that is going to be your experience or your outcome. It just means that you need to be more diligent about how you care for yourself and going to your appointments, making sure that you're showing up routinely based on whatever your provider is recommending. If your provider recommends you get a mammogram every year, please go get your mammogram every year, because missing that mammogram could result in, yes, a completely different outcome. And just sitting and listening to you ladies' stories and thinking about my own family and my own experiences, infertility, endometriosis, fibroids, hysterectomies, all different types of cancer run through my family, the maternal side of my family, very, very heavily. And I don't know, I've said this before and I feel myself getting a little choked up. I don't know if the experiences that I watched my grandmother and my mother go through is what led me to nursing. I'm gonna date myself here, I'm gonna age myself. If you know St. Elsewhere, you know that show St. Elsewhere, then we're in the same generation. But I remember watching St. Elsewhere at around maybe 7, 8 years old, and I said, I'm gonna be a nurse. And I've only ever wanted to be a nurse and only ever worked in healthcare. And I don't know what the driving force for that was. Maybe it was seeing my family members in pain and having these surgeries and not receiving the support and the care that they needed within the healthcare setting back in the 70s and 80s. But I feel like Dr. Washington and myself and Dr. Plummer? Yes, Dr. Plummer are so necessary and so essential to make sure that we have better outcomes and that we live long enough to share our stories. Because if we don't share them, what happens with the generations that are gonna come behind us?
So much, ladies. So, Sorcia, can you kind of explain what else you do? I know you mentioned before that you advocate and that you teach and educate, but kind of like give people just a little bit more.
So besides the advocacy, I like to create safe spaces and safe experiences for Black women to explore their health, their self-care, and their healing. I believe that our healing is a collective as well as an individual experience, and creating soft spaces where we can come together, where we feel seen, where we feel heard, where we're not judged, are important to me. So I've taken my experience, professional experience in nursing and midwifery and public health, coupled with my personal experiences, and brought those together to create a coaching and consulting practice. So I work with women to better their health, find balance in their lives, and then I also work with women-centered organizations to help them understand the health disparities that affect Black women and other women of color, and to create programs, educational programs, advocacy, and even change the environment that they work in, the cultural environment that their employees are working in, to help improve our outcomes. When I was a little girl, my bus driver used to say I had diarrhea of the lips because I was always talking, never stopped talking. I was talking about everything. And I've learned that my voice is that's my gift. My voice, my ability to talk, my ability to comfort, my ability to heal through my words is the reason why I was the little chatty girl that was always talking. So I hope that answered your question.
Yes, it did. Thank you so much. And I'm going to kind of take over and kind of explain my story. I know I mentioned earlier that I'm a fibroid fighter currently, and I know we talked about before, listen to your body, and I'm very in tune with my body. So when something is not right, I know that something is not right. And for someone to tell me it's okay, I'm always saying it's fine, it's not fine. So it was about, I moved here 2 years ago, and before I moved, I got my women's checkup, and I had an ultrasound done. They said, oh, you have little fibroids. I said, okay. What does that mean? My mom and my sister had fibroids. You know, we come from a culture, a history where as Black people, we don't talk about things. we don't wait. We wait until it gets bad, and we wait until it's too late. And so we didn't have that open discussion growing up. So I found out my sister and my mom had fibroids. Okay, well, what do I do about it? Keep up with it. Cool. So I moved down here, and I was like, well, let me just go ahead and get another ultrasound done. Oh, your fibroids grew within 365 days? Okay, that's fine. And I noticed my cycle started getting heavier, and my cycle became irregular. And for me, I knew something's not right. So I went to a doctor, got another ultrasound. The ultrasound wasn't done properly. She didn't get what she needed to get, so I went back, and the doctor came back, and I said, well, I'm about to be 30, and, I would like to have children. She was like, well, you don't have kids right now. Okay. But I would like to, is what I'm saying to you. She was like, well, I can't really see what I need to see. And she did the ultrasound. So she's like, I really can't see what I need to see. And, it's fine. Maybe we can just do this and that. I said, okay. You only get one time with me when it comes to me. So I went and found somebody else. I went to Vanderbilt. I went and I told them my story. And it wasn't a woman of color, but she was a woman of a different ethnicity that also would go through fibroids. And she was like, I understand what you're going through. I'm so sorry. Let me refer you to Dr. So-and-so. Had another ultrasound. My fibroids got bigger. Also found out that I have a dermoid cyst. Am I saying that right? A dermoid cyst in my right ovary. What does that mean? I don't know. So I'm like, okay, cool. They don't do anything until it gets to the point where if I decide to have children, whenever I have children, and then they'll do something about it. So I say all this to say, I probably will find another doctor, but I say all this to say, listen to your body, because you know your body better than anybody else. You live in it, you walk in it, you wake up to it every single day. If you know something is not right, don't let anybody tell you it's not right, tell you it's okay. Don't let anyone tell you that it's fine, we'll wait until it gets worse, because it's not. And don't let anybody tell you that just because you haven't reached a certain part and stage in your life, that it doesn't matter if you haven't gotten there yet, that we'll wait. So I say this to all my sorors. I say this to everybody watching. I say this to every woman that looks like me or going through this. Please, please speak up, because I'm getting emotional. And y'all know I be crying. So, but no, seriously, but please, 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 please advocate for yourself.
Hi, I have a two-part question, I guess. I'm a second-year cancer survivor, breast cancer survivor, and I'm doing great. Thank you. I had a double mastectomy, and my question is, of course, you don't do any more breast exams. That's over. Or do you continue to try to examine yourself? My doctor was saying that you still should examine around the area. That's correct? Okay. And the other part is I have a ovarian cyst, but they're benign. They've been there for years. Should I have those removed?
Question, to answer that, the physician was correct, because sometimes it depends on how deep or how much of the tissue they remove, because you also have breast tissue that extends into the armpit.
Right.
And so a lot of times breast surgeons will recommend that you follow up with them every year, or with your GYN every year, to continue to do the examinations.
Right.
Just because sometimes if there is something that grows back, how will we know if we're not, examining? The second part, with ovarian cysts, it definitely depends on the age as well as the size of them. For some of my patients, if they're in their 60s and they've had ovarian cysts that is the size of a pea, I'm not going to be like, okay, you got to go get that pea cut out. No. I think it depends on the size, what's inside of it, because a lot of times when we do imaging, certain components, whether it's defined as a simple or a complex cyst, also the patient's symptoms. And then lastly, if I have a patient, especially if they have a history of cancer, I will do tumor markers on that particular cyst, just to make sure that this is not something that could be problematic in the future. So you don't necessarily have to get them removed, but I definitely recommend making sure that you get them evaluated.
Thank you.
Thank you. I'm James E. Callahan III. I'm actually president of Phi Beta Sigma Fraternity Incorporated Eta Beta Sigma chapter, and I'll tell you why that's important in a second. First of all, I appreciate you guys having the forum and sharing the information. Continue to educate yourselves. Obviously, there's nothing that I can tell you about Black women's experience and the importance of sharing those stories. But being a member of Phi Beta Sigma and recognizing the link between men and women, I wanted to come and support the event. I don't know an aunt, a sister, my grandmother, or my mother who did not have fibroids, cysts, and the like. Ovarian cancer, uterine cancer. One of the things that I think was fortunate for my particular family is they did share those stories. The challenge I would have for us, particularly males, and from the advocacy standpoint, I'm sensitive as a psychologist to the term women's health because I think it's all of our health. And a lot of times men are not responsive to those issues. They don't want to hear about those issues. They're uncomfortable with those issues. They don't feel that they have ownership with those issues. It's your problem. And I think that's also something that we need to kind of address and try to encourage them to say, but there are mothers, daughters, sisters, cousins, nieces, what have you. We do need to know those issues because this is an experience that, 80% of our women are sharing that we're not informed about. So thank you for having the forum. And then again, hopefully if we can encourage men to understand as well, I think that will be another level of support.
Thank you so much.
I had double knee replacement, so getting up.
Take it.
My name is Nadine, and I see some senior citizens have arrived, and I just give you my storytelling part of it. Okay, thank you. During my I didn't start my period until I was 15, and I didn't really have pain until I was in my 20s. The pain was so excruciating that I would double over, and the pain wouldn't stop until I either took an 800 milligram Motrin or threw up. And once I did one of those two things, a tablespoon size blood clot would pass, and then my period was okay until the next month. That went on for 30, 40 years. Okay, so around about the age of 49 or 50, I started the menopausal phase. And I think for 2 years, took 2 years to have that 1 year without a period. And at that time, I knew something was wrong. So I went to the doctor, and finally, after 50-some years, they decided to do an ultrasound, because before then, the only treatment was 800 milligram pills to kill the pain. So they did the scope, and the lady was just marking all these little marks as she was doing the ultrasound. And so she was marking fibroids. So I didn't even know I had fibroids until I was 50 years old. But they said, don't worry about them because once you go into menopause, they will shrink. Okay, let's fast forward 20 years. I was 70, I'm 72 now. At the age of 70, I started bleeding like I was a 25-year-old. And of course, 70-year-old women don't bleed. Now, I was looking at the thing last night. They talk about risk factors that women go through after menopause, and these factors supposedly tell you whether or not something is wrong, or they could be factors that would cause you to have problems when you're in your after menopause. Out of the 7 that's listed here, and I'm going to add an 8th one, I have 7 of them. I don't have high blood pressure, but that's something they say that could be a problem. Vitamin D deficiency, I have that. Obesity, I kind of have that too. High level of stress would make your fibroids grow. A family history of fibroids. No history of pregnancy. I have never been pregnant. And of course, the black African women, they say, are 2 to 3 times more. Also, alcohol. Because I've read that soy, cheese, and alcohol will cause your estrogen to increase. Thereby, you start feeding those fibroids again. So right now, mine are growing. So they tried to go inside to take a look at them, but they couldn't get past my cervix. They couldn't even poke it. So they put me out to really poke it. But then you suffer the consequences of maybe they're puncturing your uterus. So when we went in to do this, well, I'll call it surgery, they got through the cervix, but when they went in to inflate it with saline water, the water dissipated, just went. So they suspected that my uterus was thin-skinned or something, or that the fibroids were so invasive that I couldn't even hold water. So you might have it during your young age, but believe me, they come back. And right now, my gynecologist and primary doctor says hysterectomy. And I sent her a thing about UFE, the uterine fibroid embolization. And that's what I'm looking into now, because even though I'm not bleeding anymore, I'm still spotting. And that's at 72. So those fibroids, they are working. So that's my story.
Thank you so much for sharing that, because that, ooh, child. All right,
Yeah.
so everyone, no soy, no cheese, and no more wine. Cool, got it. I'm gonna finish my bottle of wine when I
No
get home. It's
stress, no
fine.
stress.
It's fine.
No stress.
All right, so we're gonna open up to Q&A online if anybody's watching on YouTube. Any more questions that we have in the audience?
So we have a question here. What is the average age a woman may experience fibroids?
So typically,
It's early.
Studies show early 30s, but I have had cases to where patients will, as I can speak from personal experience, I was in my early 20s.
Janae, I'm 28. From the first time I got my first period, in my family, we have a history of fibroids. I consider it like a genetic trait, like brown eyes. My mom, my aunt, 3 of my aunts have had hysterectomy. So my first period, when I got it, the pain was immense. I mean, I had to be out of school for the first 2 to 3 days because I'm vomiting. It's unbearable, but I'm told it's normal. And so when I was younger, my mom would get her menstrual cycle and it would be so bad that a pad wouldn't work. She would have to use Depends. And I remember in one case, she had on her Depends. She had just left work and she was in pain. She got out the car, she bled through the Depends, bled through her pants, and had soaked the car seat. And so I've always thought I haven't gotten that bad. So we're gonna fast forward. I was told I had endometriosis, and at the time I was, 15, 16? They were like, birth control will help. Was on birth control. It made me have normal periods. So I went from 2 weeks to your 3 to 5 days. The pain wasn't as bad. I could still function, but I was still in pain. Fast forward, I had my first kid. After that, I'm like, the math ain't mathin', something's not right. They were like, oh, it can come back. It can be a little more painful. You need a higher dosage of birth control. That's all they've ever prescribed for me. Fast forward, got off the birth control, got pregnant, and I want to first start off by saying, fire them. The first time they don't listen, I'm firing them. So got pregnant, things weren't right, went to my OB. She was like, oh, we'll see you in a couple of weeks, you're fine. It could be a miscarriage, but you're okay. I went home that night, bled out in my bathroom. Woke up, I didn't wake up, I texted my sister. My message didn't make sense. She had a key to my place. She came over, she found me. Got to the hospital, they took care of me. I fired my OB right then and there. We're gonna fast forward. I was fortunate enough to have another pregnancy that went on, and I was still having excruciating pain. I had a period the first, I want to say 3 to 4 months, so I didn't even know I was pregnant because nothing told me that I was. And I remember telling my OB, like, I'm hurting, I'm in pain. And this was a white woman, and she would be like, oh, you're fine. And at the time, we're in the pandemic, and we had just started going back into the office. And I'm like, look, I'm still bleeding every now and then. I'm in excruciating pain. This woman was just like, oh, you're fine. And she made the comment where she was like, you know, you're stronger than what you think. I fired her 2 days before I gave birth. Fired her, didn't care. Fired her, went on, had my baby. We're some months down, I'm getting my period back, and I mean, I know it's coming because the pre-symptoms are just knocking me out. I'm vomiting, I can't stand, I'm doubled over. The heating pad is living on me, so my stomach is constantly red. I'm breastfeeding, and I'm very cautious about what I take, so I'm trying not to take ibuprofen or anything. I go to the doctor, and I'm telling her what's going on. She puts her hands in, and she's like, oh, I can feel the fibroids. And I'm like, so what are we gonna do? And she was like, birth control. So here I am on birth control, and I've been going in, and I'm telling them, like, hey, I'm still bleeding, I'm still cramping. Like you said, if I don't vomit, then I'm out for the count. I'm fortunate to work from home, so I can struggle in my peace. But I've been on birth control now. My daughter is 1. I've been on it for, 6 months? And I feel like it's getting worse. And when I go in, they're like, well, you do have the fibroids. We do see it. But they're not a risk right now. And I'm like, the math
But
don't
it's-
math.
Yeah, if it's affecting your quality of life, it's a problem.
And then when I heard no wine, I mean, look.
Listen, I will say,
You ain't the only one.
Right. Well, everything in moderation. Moderation.
Okay. I got 2 kids.
It's real.
I
It's
need
real
the
out
wine.
here. It
And
is.
so I say that to say, I'm probably gonna fire this one as well.
Okay.
And I'm very adamant on, I need Black women in my life. It's very, very hard in the area that I live in. I live in Clarksville. The only hospital out there is Tenova. And it is known as the death trap. Yes, you guys, I drove from Clarksville all the way to Nashville to give birth. My boyfriend was like, you're in unbearable pain. I'm like, we can make it down the interstate if you drive fast enough. I refuse. I will not see an OB in Clarksville. That's where I was told that my baby was fine, and I ended up bleeding out, was Tenova. So I learned that quick. But I say that to say, it is sometimes hard to find the care that you need because I have been struggling. I'm on the phone with my insurance company, and they're like, what are you looking for? And I'm like, Black people. Like, I'm not gonna lie, I'm not gonna sugarcoat. I'm like, I need Black people. And they're kind of like, But that's just the reality of it, and it's really hard because you can sit here and say, oh, I'm in pain, and you can express the pain, you can show the pain. I have to wear Depends on my cycles because pads and tampons ain't doing it. And then the pain is so uncomfortable that I'm not sticking anything up in there. And so things like this are very helpful because people say, oh, well, that's not normal. So then you don't speak about it. But then you hear like, nah, baby, it's normal. It's normal. It's just unspoken. And my only cure has been birth control up until this point. No one has talked to me about changing my diet. I know I have a caffeine problem. I'm working on it. I'm down to 1 cup a day. And if you know, you know. If you know, you know. I'm down to 1 cup a day. I only have wine on the weekends. Like, I'm making changes, but no one has ever said anything. They're just like, oh, get birth control. And I had the implant, and when I got it put in, it was fine. The doctor who took it out, she didn't care how she got it out. She left a scar. I fired her too. And now I'm on the shot, and I'm telling them it's not working, and they're like, you want the implant? And I'm like, no, there has to be something else. And they're just like, well, we can just keep giving you different forms of birth control up until you're at the point of being a risk, and then we'll take other measures. And so now I'm hearing what other women are saying, and, you know, God gives his battles to the strongest. I'm not that strong, and I'm not going to make it that far in life with what I've got going on, and I'm only 28.
That you had to experience that, I think is unfortunately, someone has to go to that extent to get treatment. But as I stated on that slide, there are other options. Now, I will be honest with you and say that those options are newer just because with technology, we're trying to find different things. But what I would, and we can have a conversation, in private about other options that based on your symptoms that I think may be a better fit for you than just hormones, because sometimes that doesn't work. And in medicine is not cookie cutter, so there's not always a way to fix the same person. Everyone's not going to be fixed the same way, but I do commend you for being, an advocate for yourself and speaking up. One of the things I also want to add that I didn't get a chance when I was looking at the panel is not just with the GYN component, but also with the obstetrical component. One of the things that I have incorporated into my practice is working with midwives. There's like this taboo stigma here of like, oh, midwives and OBGYNs can't work together. That is far from the truth. Actually, my top two that I work with in my hospital are women of color. We call ourselves Batman and Robin because for me, if I'm delivering and I can't be there to advocate for that patient, I know the midwife will be there. And I understand just like how all physicians aren't created the same, all midwives aren't created the same. So sometimes, yes, we do bump heads, but I've been blessed enough to find two that really understand my patients, advocate for my patients. And so for those who are of childbearing age and are considering that, I do honestly tell my patients, especially for my first-time moms, like if you are in a city and you don't find that doctor of color, that you do look into getting a midwife. Yeah, because what people don't realize, before we had these white coats, we weren't into hospitals, so the midwives were our delivering, they delivered. And so I think a lot of times people's like, oh, you shouldn't get, no, I think finding the right midwife, one that is recommended and reputable and know what they're doing, of course. I think that we can work together to bridge that gap when it comes to health and for women of color. So I did want to add that because you're a midwife, right?
I am, but I'm no longer in clinical practice.
Okay. Well, why are you coming? No,
I'm no longer in clinical practice because I'm really committed to the education and advocacy. And delivering babies is hard work.
Yeah, it is.
It's hard work, and my body just is like, you need to sit down. So no more. I'm not in clinical practice anymore. But I will say, I heard you speak about strength. And one thing that I've learned to step away from in my own personal definitions or words that I attach to myself and to other women that I'm either coaching or in consulting spaces, I no longer use the words strength and resilience when I talk about Black women, because I feel that that does not give us the space to be vulnerable. And so many of us are walking around burnt out, beat down, stressed out, tired, overwhelmed, but we have this overarching idea that we are supposed to be strong and resilient and we can handle it all. And there are a lot of women in our own spaces, some of those who are no longer here with us, that carry the burden of life on their backs and on their shoulders, and it took them out. So I encourage you, this is the nurturer in me speaking, please release those terms from your vocabulary. You do not have to be strong. You do not have to be resilient. You can be vulnerable. You can find soft and safe spaces to exist within your healthcare and within your life in general.
Today we are releasing strength and resilience. Not say those words anymore. So.
Hey, how y'all doing? So I have heavy, very, very heavy periods. When I was a teenager, they put me on birth control. No, I was angry, I was happy, I didn't like it. So when I got in college, I got off of it. But my periods are very, very heavy to the point where I'm wearing like, the maxi, like the purple pack as always. I gotta have like 2 of those. And I get these like cysts really bad, like between my breasts and under my armpits. And like all they ever want to do is just give me antibiotics. And it's like not working. It happens a lot during like my period. And also it seems like the older I get,
I cramp more. Like when I was younger, I really didn't cramp, but like the older that I get, and each time I have my period, it's like I cramp more. I did go to OB/GYN, I got a pap smear, and she was like, oh no, everything's fine, everything's fine. And I was like, okay, well, this is happening. What's going on? And they just wanted to push like birth control on me. And I'm just like, I don't know if I want to do birth control because I don't know like how I feel about it, all the side effects and everything like that. And I don't want to always have like pills pushed on me all the time. Like I want like other alternate things. So what would be your suggestion as far as like when you're looking for a doctor? How can you set your intent? Okay, because I'm gonna be honest with you, I'm very blunt, and I can be very rude. Because my last OB/GYN, I'm like, look, this is God, this is gold. So if you mess this up, I will find you. But how do you set the standard without being rude? And then how can I feel more comfortable? Because sometimes like she was telling me something about my testosterone and estrogen level. She was like, because like I get the facial, like I call it my 345 shadow. So I get like, and I don't know what to, and it's like embarrassing, and I'm like real, insecure about it. So like, what do I do? Help.
So, so when you saw the provider, did they do any blood work or imaging? Because for me, usually if a patient, depending on what their symptoms are, I kind of write out what I think in terms of a work. And so my question is that if you're having this bleeding, then I'm going to want to take a step further and be like, okay, well, let's do imaging to see, because everything isn't always fibroids. Sometimes it could be an ovarian cyst. Sometimes the lining within the uterus could be thickened, which could cause abnormal bleeding, but it could also be symptomatic. And so, one, it's nothing wrong with you being an advocate and being blunt. It's just a matter of finding that physician that is okay with that. And just to add to that, not just because, and I get it in healthcare because a lot of, when it comes to GYNs, I think for me, even in this area, it's not that many. I do have patients that come from Atlanta, Clarksville, Memphis, just because of that disparity that's there. But even if it's someone who doesn't look like you, if you feel comfortable and feel like this person is actually listening to you, I definitely think that would be a good fit. And then once, based off of your symptoms, I do think that maybe doing imaging and blood work, because sometimes if the testosterone levels are elevated in the body, it can cause you to manifest more masculine symptoms than others. But it's hard to determine that just by looking at you. It will, require a more thorough workup. Does that make sense? And a lot of times, and another subject that we didn't touch on, and then I, of course, pass the baton to you, is also with polycystic ovarian syndrome. It's a vicious cycle, but what I can attest to from my experience, a lot of it is driven by our diet and the amount of adipose tissue that we have, because what ends up happening is the more adipose tissue you have, that estrogen gets sucked into the fat cells, and as a result, the testosterone or progesterone manifest more. And so sometimes patients have irregular cycles, they have painful cycles, they have more hair distribution. It's just like, almost like, I call it like a trifecta. It's like this vicious cycle that happens, more and more and more. And so also the key component is sometimes with my patients, if I do a panel and it looks normal, I may go a step further and refer you to an endocrinologist, because sometimes certain hormones have to be taken at a certain part of your cycle to determine if this is really the case, if that makes sense. So whenever that time comes and you provide that provider, just ask them, like, would you recommend or would you refer me to an endocrinologist just to do a little digging deeper, because sometimes everything isn't just estrogen, progesterone. It's other hormones that are playing a factor that can also cause those symptoms.
So we have another question from online. What are some treatment options for PCOS when periods are irregular?
Well, I know we're talking about hormones, but hormone treatment, lifestyle changes, dietary changes, would typically be the recommendation, the initial recommendation for
No
treating
wine.
PCOS. No,
No
well,
wine.
moderation.
I'm still stuck on
moderation.
it. I'm sorry.
moderation with the wine. But yes, hormone treatment.
And I definitely piggyback off the diet and lifestyle. I've seen patients, if they can lose at least 10% of their body weight, I have noticed a change in their cycles. They're a lot happier, especially their sugar. Now, you know we from the South. We love a good peach cobbler. We love a good sweet tea. But I'm telling y'all, just those small changes, you will notice the difference in your cycles and the way that you feel, especially with polycystic ovarian syndrome.
Yeah. And I think a lot of times when we say the word diet, people think it's all or none. It's really about balance and moderation. So instead of having peach cobbler every day, maybe you just have it once or twice a week. My weakness is Snickers bars.
Ooh, yeah.
And Mike and Ike's and Swedish Fish. I could go, it's sugar, it's candy. So I've had to dial myself back from eating it every day. But have I eliminated it completely? No. Do I notice a change in my body? Absolutely. So moderation. All or none really does not work for most people, but moderation does.
Can you touch a little bit more on fibroids and menopause and what the options are? Like what's the likelihood of them, as you said, decreasing? And what are the options?
So for patients, and to piggyback off of what she was saying, a lot of times we do tell patients that, yes, by the time you hit a certain age, because with menopause, that estrogen level should decrease, and that's what feeds the fibroids. But everyone is not the same. And so I have had patients who have still had bleeding issues despite them being of a certain age or level of maturity, as I say. But, and so treatment options, I usually tell patients when we have this conversation, no matter what the age, I ask, what are your goals? Do you want to have children? Have you completed childbearing? Because for those who are like, okay, I don't want children, or I've already had children, or I'm at the age where I don't want to conceive, usually for them, we do the other approaches that were mentioned before. There's one that's called a uterine artery embolization, and it's where it's done by a radiologist. And depending on the size of the uterus and fibroids, they go in and they pretty much, it's like they go through the leg and pretty much they cut off the blood supply to the uterus. Minimally invasive, so you go home the same day. But I do like that for some patients of a certain age, just because it's less downtime, it's less invasive. And at the same time, it doesn't, it has less side effects as under the other option, as we spoke about before, was the radio frequency one that's come out, to where they're like pretty much breaking up the fibroids as people like gallstones. Those are two options. And then the last option, of course, a hysterectomy, and thank goodness now we are more advanced in how we do hysterectomies. The newest thing is a robot, so where we, the physician is in a box, but we're using our hands to help, and we make smaller incisions to where we're removing the uterus, and so most patients can go home the next day as opposed to getting that big old, that up and down incision that Big Mama and them used to have, and and it's less complications because with the robot we actually can see everything in real time. So no matter what the patient's body habit is, it provides a more safer treatment option. So the three would be radio frequency, uterine artery embolization, surgery in terms of those approaches. And then last but not least, some patients do the intrauterine device in the form of Mirena. I personally have that one because I have fibroids, and so I don't want surgery. So I was like, you know what, we just this, because it suppresses my cycles but also my symptoms, and it prevents my fibroids from growing. And so I was like, well, this will give me a Band-Aid until the good Lord sees fit. So does that answer your question? Okay.
We have time for 2 more questions, one in person and then online.
Hi, I grew up in the age where, my mother didn't really do a lot of talking. She gave me a spiel about 6 months before my period came on about what could happen, and you can't have sex, you have babies and all of that. And that was about the end of it. And I grew up having cramps, double and stuff like that. And I guess, and I had really bad cramps. And finally I went to a doctor and he told me I had fibroids. And if I wanted kids, I better go ahead and have them now, which I didn't think. I waited till God blessed me with a husband and everything. But to get to the point, and I do still have some problems. But I'm more concerned about my daughter because when she started her period, she started having really bad cramps, and I guess when she was about 14 or 15, the doctor said we need to put her on some mild, low doses of birth controls and stuff like that. My daughter's not good at taking medicine, so that was short-lived. And still now, she's 23, and she has debilitating cramps to the fact that she just started, graduated from college and started a professional job. And she said, "Mama, I went to the bathroom Monday morning and I saw the blood, so I had to call in because she knew that she was not going to be able to make it, and she has cramps almost the whole time of her period, real heavy periods and stuff like that. And she's not in Nashville, so I can't really get her to help. And we have a hard time trying to schedule an appointment for her to get here to get to a doctor and stuff. So I just want to know what can happen because I don't know if the doctors have ever diagnosed her with the fibroids because when she got 18, she became a little more secretive. She will share more now because she's, we went through the battling, she has PMS really bad. So I had to call her out because every month, about 7 days before, she get real evil and stuff, and I had to tell her about herself. And she accepts it because, she accepts it because, she understands now. I said, you have to watch yourself. You have to watch your tongue. You have to, even with her friends, I have to call her down. And I'm glad you did say alcohol increasing. I'm going to try to get her to look at this, afterwards, because I didn't know it was going to be online. I would have told her to watch, but she's probably going to be upset. But I know she does do a little partaking that I've been trying to discourage her from anyway, so maybe that will help. But, what can I do? She's not in the city, but she does have, and I'm really concerned because I'm like, okay, you just started a new job. You can't have the reputation of calling in, every month because you can't make it, because your cramps are so bad and your flow is so bad. So what can I do?
So one of the things, since she's employed, I'm assuming she does have insurance, correct?
But she's still on mine.
Oh, she's still on your, okay. So what I would recommend is definitely getting her in with a gynecologist because, like I said, everything isn't always cookie cutter in terms of a patient's symptoms. And even if she's out of, depending on what network she's in, definitely try to find, if she's more comfortable with a female provider, that's totally fine. There is a website, and I have to think of it, it's one where they're actually trying to build a database to where you can actually look online to find a provider of color, no matter what specialty, whether it's psychiatry, whether it's cardiology, and things like that. And so thankful to the internet if she wants to maybe, you guys have a come to Jesus moment about everything. And then once she's comfortable, getting her in with someone, because like I said, sometimes it can be fibroids, but as you can see, based off of other symptoms, it's not always that. And I think first establishing and trying to get a diagnosis for her would definitely be beneficial.
Right, because her doctor here had recommended her to a specialist, but somehow I don't think she ever went. She told me she did, but I'm pretty sure because I kind of micromanage her a little bit too much, as my friends say. But I don't recall her going. But I do want her to get to a specialist to get her some help at an early age, so she won't suffer like I did for all those years.
Absolutely.
Okay. Any questions online? We have time for one more question.
It's not really a question, but it's actually a story, an encouragement. I encourage everyone to talk to their family members. Not everyone has insurance. Make sure everyone is on insurance. Okay. I don't normally cry. Mama period. Y'all.
Sis, we all emotional today. It's
all
fine.
right. It's all right.
It's fine.
But
It's all right.
So my cousin, a few years back, she had 3 kids, was in an abusive relationship. At 25, she was beaten so bad she had to go to the ER. That's when she found out she had stage 4 ovarian cancer. She wasn't going to the doctor because she didn't have insurance and she didn't have the money to pay. So I encourage everyone to talk to their family members. If they can't pay, if y'all have a kitty for your family, put that kitty together and get somebody some insurance, because preventative care would have saved her life. She did die. She lived 2 years after her diagnosis. But even to see her, I don't want to say waste away, but to see her go from where she was at, and then 2 years later, just stuck to a bed. And that's not how she wanted to live. But it's what happened because she didn't have any type of preventative care. She didn't go see a doctor. Even after having her 3 kids, she had her 3 kids and was done with the doctor. Thank you. So I encourage everyone to talk to their friends, talk to their family, talk to everyone. Get insurance, go see a doctor, because it can happen at any age. I know it. The slideshow said at 55, but like I said, she was 25. Thank y'all.
Lastly, I want to add to that, and that's very important, especially when you're in major cities like this, just know that there are options for patients who are uninsured. I'm a proud graduate of Meharry Medical College, and we do have programs there for patients to where it's based off of their income, and if they don't have money, it is free of charge. I think a lot of times people, when they think of county hospitals, they think of, the stigma that comes with that, but that's not always the case. I think for us, a lot of us that are trained there appreciate the mission because of the fact that we are caring for the underserved, and we have diagnosed patients at various ages. Other resources besides that will also be like Matthew Walker for patients who are uninsured, because as she stated, early detection and preventive medicine is definitely key to our longevity. Thank you for sharing.
That I'm a senior citizen, yay, and they are paying you to do pre-screenings. They are paying you to do screenings. So all of these tests, like breast exams and mammograms and pap smears, they pay you on the other end to go get these exams, so that you can have all these tests done, so that it's not I got to go to the hospital now, and now you're in stage 4 cancer. So, do these things on the front end so you don't have to get these stage 4 results on the back end, and so these services are out there, but you got to be in the know. You got to do your own education. You got to be your own advocate and speak for yourself, and I'm an example of that, and I've had doctors too, and I've fired them because they were not doing what I needed them to do on my behalf. And that was on me because I chose them. They didn't choose me, I chose them. And if they didn't act right, they didn't do right, didn't feel right with me, I got rid of them. And I just had one that I did get rid of. My gynecologist was my best friend, and he worked for me. When I told him I had some problems, I think I got fibroids because my mom had fibroids, he said, I got something for you, girlfriend. He took me into the hospital, did that thermal, whatever it was, burn off that top layer. That was the best thing for me because I never had another period, never had no more pain with menstrual cramps or anything like that. Never again. And it was the best thing ever for me. That was my testimony. But I know it didn't work for everybody. But I could talk to him, and he was not a man of color. He was not a man of color. So they're not all bad, but you got to search for them. They're out there. And so, you have the option to getting a second opinion. They do pay for you to have a second opinion. You just got to get out there and work for them. So, it's what you're willing to do. How far are you willing to work? And they're going to make you work for it. They ain't going to just fall into your lap. You got to work for it. So I'm just here to say it takes work, and you got to get up off your butt and get up there and do it.
So much. So, as y'all know, we could talk all day, but we're going to end this discussion. Thank you so much for everyone coming out, for all the experiences, for all the storytelling, for sharing, to the health ministry like Providence Church, to Dr. Washington, to Sia, to everybody here. I really appreciate it. And we're going to head on back to Dr. Plummer and Dr. Britt to close this out.
Thank you, Ashley. Thank you to Dr. Washington and to our guests, nurse practitioner Asia. We appreciate the expertise, the love, and the empowerment, because that's what it's about. As a 20-year public health practitioner, prevention is key, and we do advocate for prevention, and that means go to the doctor. If you have insurance, preventative care is covered. That is one of the beauties of the Affordable Care Act, often known as Obamacare, but that was one of the benefits that was put into the Affordable Care Act, that preventative care was afforded to those that have health insurance. For those that don't, there are other resources. There is healthcare.gov does offer health plans under various coverage levels, and there's also other health plans that are available through Medicaid, or if you're in Medicare age eligibility, preventative services are covered. So be an advocate for yourself and for others. And if you know someone and they don't have health insurance, then help them. There are assistance made available through various organizations, and enrollment time will be coming in the fall. So, and also watch our website at LPMBC.org. We do post information on our health page, so we encourage you to watch. And I would also like to invite you to come back. We will continue our mini health series as we forward on to our Health Expo, which is September 16th. It is a Saturday. We start with a walk, and so we can get our bones moving and all the endorphins and be happy and celebrate, because we're excited about being able to come back together. And we will have information and guest speakers, so please continue to watch our social media outlets on the different vendors that will be presenting. There is a link on our up on the screen and on site of helpful resources. We will make that available on our health ministry webpage, which is part of our church webpage.
We want to thank each of you for coming out today. We want to thank our ladies of Sigma Gamma Rho for partnering with us, or allowing us to partner with them to produce this experience for each and every one of us. I think it has been awesome. I thank God that we were able to provide a safe place for you to talk. Even though we're online, we appreciate your sharing. And as she said, join us for our Health Expo in September. And we encourage each of you to take good care of yourselves. We encourage your self-care. We encourage you to listen to your bodies. We encourage you to advocate for yourselves. Thank you so much again for coming, and God bless each and every one of you.